Happy Tuesday, everyone. I'm Dr. Tisha Rowe, family medicine physician in Houston, Texas, and I wanted to talk to you today about ADHD. I have seen so many patients with ADHD over the past year. It is out of control. And it made me wonder, are we overdiagnosing ADHD? So today I'm not going to talk about all the symptoms, all the treatments. If you already have ADHD, this is something that you know. But I want to talk about other things that may present with problems with concentration, leading you to think that you have ADHD when you really may have a different problem. Number one, people who are depressed often will have issues with attention, concentration, memory. It's one of the things that we screen for when we're screening for depression. So if you are feeling sad, anxious, and you're taking ADHD medicine, but you've never been formally diagnosed, I would strongly suggest making sure you are talking to your primary care physician about other things that could be going on. Now, when I say not formally diagnosed, what do I mean? So many patients that I see, when I ask who diagnosed you with ADHD, they went in somewhere, they filled out a piece of paper, and someone said, bingo, you have ADHD, without any actual neurodiagnostic testing. There's a formal way to diagnose with ADHD, people with ADHD. Two, if you have had a traumatic brain injury. Now, some people think about traumatic brain injury as, oh my God, like you're in the hospital, brain dead. But actually, traumatic brain injury can occur many other ways. One of the most common ways is with a motor vehicle accident. So if you've ever been in an accident, you may think, oh, it wasn't that serious. But then after the accident, you start having memory problems, you start having headaches, things that you did not experience before. It is very important that you see a neurologist and get an EEG done to make sure you did not suffer brain damage. You may think, oh, I didn't hit my head. There's something called shear stress, where simply your head going forward and backward very quickly, you're slamming your brain back and forth in your skull, can actually cause traumatic brain injury. Other things that can cause traumatic brain injury include like sports. So you played football, you loved it, it was great. Never played professionally, but you played for years. Get an EEG before you let someone label you with ADHD and ignore the underlying problem. This one is a little touchy, but I'm going to put it in there. Were you abused as a child? And you may not think it was abuse, but were you severely beaten, head slammed into the wall, hit with objects? You might have traumatic brain injury. And over time, you have had issues concentrating, issues with memory, and were told you had ADHD, but you never actually disclosed to a doctor those parts of your past that you put behind you. So I just want to put that out there for people who suffer with ADHD, making sure that you have a diagnosis that is formally diagnosed and not just putting a patch on a problem. Why is this important? If you have actually traumatic brain injury and not just ADHD, and you totally could have both, you may be at risk for early dementia. So we've seen Bruce Willis and Wendy Williams most recently diagnosed with dementia. And oftentimes we don't know why that happened. But if you start looking at what's going on early and making sure that you avoid, you get the appropriate workup, get the appropriate medication, and you're not just treating the problem without actually getting to the core and the diagnosis, you will be much better off in the long run. So this is my medical moment for the week. It's not Medical Monday, guys, but I hope you don't mind that I was a day late this week. If you found this information helpful, please put an emoji in the comments. Like, give me a thumbs up, happy face, whatever. Let me know. And let me know if there are any other topics that you want to hear about. As a family medicine doctor, I treat a lot of different things. When it's outside of my scope, I do send to specialists. But if there are any topics, any medical questions you have, please put it in the comments so that I can respond with a video, answer your question, or make it my next Medical Monday. All right, guys, I am actually heading to City Council to speak about mental health and the lack of resources in our community. If you are struggling mentally, please make sure you ask for help. Don't be ashamed. It's something that is, I really think, a crisis and not enough resources in our community. So be sure to ask for help, get help, and find the resources available to you. All right, I hope everyone has an amazing day.